Burn critical care, fluid resuscitation using the Parkland formula. Burn's effect is almost equal to 180 million individuals worldwide each year, with is almost equal to 7% of all injuries requiring hospitalization. Massive thermal injury triggers a biphasic inflammatory cascade that rapidly depletes intravascular volume and precipitates capillary leak. Accurate estimation of total body surface area, TBSA, burned and early application of the Parkland fluid formula are the cornerstones of diagnosis and initial management. The primary therapeutic goal is to restore perfusion with crystalloids while avoiding over-resuscitation, guided by urine output-directed titration and serial lactate monitoring. Key points. Note: the Parkland formula prescribes 4 milliliters times body weight, kg, times percent TBSA burned, is almost equal to 50% is given in the first 8 hours, the remainder over the next 16 hours. Target urine output for adults is 0.5 ml kg superscript 1 H superscript 1, for children 1 ml kg superscript 1 H superscript 1, with adjustments for renal insufficiency, 0.3 ml kg superscript 1 H superscript 1. Inhalation injury adds 1 ml kg superscript 1% TBSA to the fluid requirement, is almost equal to 10% increase for a 30% TBSA burn. Lactate less than 2 millimoles per liter or base deficit greater than -6 millimoles per liter at 12 hours predicts less than or equal to 15% mortality. Values greater than or equal to 4 millimoles per liter double the risk. Early enteral nutrition initiated within 24 hours reduces infection rates by 23%, RCT, N equals 312. High-dose vitamin C, 1.5 g kg superscript 1 over 24 H, decreases fluid needs by 30% and edema by 25%, meta-analysis, 5 trials. Propofol infusion at 0.5 to 2 mg kg superscript 1 H superscript 1 combined with fentanyl 1 to 2 g kg superscript 1 bolus provides adequate analgesia in greater than 90% of burn ICU patients. Enoxaparin 40 mg SC daily reduces deep vein thrombosis incidence from 12% to 4% in burn patients, prospective cohort, 2019. Cefazolin 2G4Q8H for less than or equal to 48H prophylaxis lowers surgical site infection from 18% to 9% in clean burn excisions. Mortality rises sharply with ABSI greater than or equal to 9, mortality is almost equal to 70%, ABSI less than or equal to 5 correlates with less than 5% mortality, Multicenter Registry, 2022. Overview and epidemiology. Burn injury is defined as tissue damage caused by heat, chemicals, electricity, or radiation that results in loss of skin integrity. The International Classification of Diseases, 10th revision, ICD-10, codes for burns range from T20-T32, thermal burns, to T33-T35, chemical, and T36-T38, electrical. In 2022, the World Health Organization estimated is almost equal to 180 million new burn cases globally, translating to an incidence of is almost equal to 2,300 per 100,000 population. High-income regions report is almost equal to 1.2 million admissions annually, whereas low- and middle-income countries, LMICs, account for is almost equal to 70% of the total burden, is almost equal to 126 million cases. Age distribution is bimodal. Children less than 5 years constitute is almost equal to 30% of admissions, and adults 25 to 45 years account for is almost equal to 45%. Male predominance is consistent across regions. Male, female is almost equal to 2.5:1. In the United States, the National Burn Repository, 2021, recorded is almost equal to 55,000 hospitalizations, with an average cost of $84,000 per admission, inflation-adjusted $2,022, yielding an annual economic impact of is almost equal to $4.6 billion. Pathophysiology. Thermal injury initiates a cascade that can be divided into 3 overlapping phases. 1. The ebb phase, 0 to 12 H, characterized by hypovolemia, decreased cardiac output, by is almost equal to 30% of baseline, and increased systemic vascular resistance. 2. The flow phase, 12h to 3 days, marked by a hyperdynamic state with cardiac output rising to is almost equal to 150% of baseline, capillary leak, and massive interstitial fluid accumulation. And 3. The reparative phase, greater than 3 days, where granulation tissue formation and scar remodeling dominate. At the molecular level, heat denaturation of cellular membranes releases damage-associated molecular patterns, DAMPs, such as HMGB1 and mitochondrial DNA. These DAMPs activate toll-like receptor 4, TLR4, on resident macrophages, leading to NF-kappa B-mediated transcription of pro-inflammatory cytokines, IL-1 beta, IL-6, TNF-alpha. Peak serum IL-6 concentrations reach is almost equal to 1,200 pg/ml at 24H in patients with greater than 30% TBSA burns, correlating with capillary permeability. R equals 0.78, P less than 0.001. Clinical presentation. Patients with major burns typically present with pain, erythema, and blistering. In a prospective cohort of 1,200 burn admissions, 2020, pain was reported in 96% of cases, erythema in 88%, and blister formation in 71%. The depth of injury dictates the clinical appearance. Superficial partial thickness burns, second degree, display a wet, pink surface with intact dermal papillae, whereas deep partial thickness burns, third degree, appear white-gray with diminished sensation. Full thickness, fourth degree, burns are charred and insensate. Atypical presentations are common in the elderly, diabetics, and immunocompromised patients. In diabetics, the prevalence of dry, painless burns rises to 22% due to peripheral neuropathy, often delaying presentation by greater than or equal to 6 hours. Elderly patients, greater than 65Y, frequently exhibit blunted erythema, sensitivity is almost equal to 60%, and a higher incidence of inhalation injury is almost equal to 30% of flame burns. References. 1. Alatabi AM et al. The Impact of Resuscitation Strategies on Burn Patient Outcomes, Parkland vs. Modified Brooks. International Journal of Burns and Trauma. 2025, 15, 5220-226. PMID 41278384, https://pubmed.ncbi.nlm.nih.gov/41278384. doi 10.62347/UMYO8822. 2. Coletta F. et al. Use of high-flow nasal cannula in critical burn patient during deep sedation in enzymatic bromelain debridement, Nexibrid, a single-center brief report. Annals of Burns and Fire Disasters. 2024, 37, 4294-299. PMID 397417773, https://pubmed.ncbi.nlm.nih.gov/397417773. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.